right here in the white, as you guys can see, because stuff like this will grow legs and walk on you. I'm telling you, for me to be like, okay, look, here you go, take a picture, click, go pills and put them all in one bottle. So I have, I hope this video does not get flagged because it's really not like that, okay? Hey guys, how are you? Welcome back to my channel. So I have today off and I wanted to sit down and film a what's in my work bag for you guys, which I have not done in a while. So this is my work bag. Yes, I carry this huge thing to work with me all the time. I carry a lot of stuff with me to work, so I needed a huge bag, and I have been in love with this bag ever since I purchased it. If you guys are interested in seeing what I carry with me to work on a daily basis, whether I use all the items or not, just what I have with me, then please keep watching. So starting off, this is my S-Ven bag. It is just a dark blue color with some like floral prints on there. I actually purchased this from Amazon. If I can find it, I will link it below if you guys have an interest in it, because it's such a huge yet sturdy tote bag. It has a very nice zipper on the back, and then it has two pockets here, which allow you to store a lot of items. So starting out on the outside pocket, I have my taser, which I always carry with me because I park in a parking garage and you never know, just because it's dark, I always want to have something with me. This is a little bottle of hand sanitizer that was given out to us, so I just keep that in there. And then I have a quick pen thrown off to the side, because you guys know nurses have pens everywhere. The other side is empty. That's where I throw drinks and little snacks and things, like shove them down in that side pocket. So we're going to jump into the inside, and I'm going to try to show you guys this tote organizer that I purchased, because this thing is so deep and so big. I wanted a way to keep everything organized. So this is the organizer itself that goes in the bag, because I like to have things organized. That's the thing with tote bags, like you throw stuff in there and you'll lose them. So I ordered this tote organizer from Etsy. I think this is actually the kind that you can put in your Louis Vuitton Neverfulls. So yes, this is my tote organizer. So everything that's in the bag is really in the tote organizer. So we'll just go through that. Yes, sis has the Phytoplex from work. You guys, this cream is so good. I'm telling you, not only does it have like a subtle scent, but it really does keep your skin moisturized. I'm like, look, if it's good enough for y'all to have in the hospital and we're rubbing this on our patient's skin, I'm putting this on mine. So I have the Phytoplex. But I do also have a bottle of the Gloves in a Bottle shielding lotion as well. Also good for dry skin. Another pocket that is full of nothing but pens and Sharpies. And also a pen light. As well as a bottle of the Crest mouth spray. Honey, I'm telling you, wearing that N95 mask all day, you do not want to be rebreathing whatever food you may have had throughout the day. And then you take that mask off and the first words you say to somebody and you're like, honey. Yeah, no, you don't want to be that person. So I have the Crest spray. Literally, you just twist it and you're good to go. So always be prepared. I have a ear saver in here. I currently wear one, and then I have another one in here in case I lose that one or break it or whatever. There is a chapstick in here. This is the Blistex Ultra Rich Hydration. I have a roll of trash bags. So you guys might be wondering, why do you have a roll of trash bags? What are you doing? So this is what I put dirty clothes in when I am leaving work, or anything that I think is visibly soiled, anything that has gotten soiled, anything like my shoes. When I take my shoes off, even though I change shoes in the car, because I don't drive with my work shoes on, I drive with a pair of sandals on, I still put my work shoes in a plastic bag because I'm stepping around stuff. Yes, I wear shoe covers and things like that, but I put things in plastic bags just because I'm trying to really reduce the transmission of Rona, COVID going around. Here, I have another scrub cap in here. I have not worn this yet. That's why it's still fresh in the plastic. I purchased this for my coworker. So I'm filming in front of natural light if the lighting changes a little bit. Her father started off making these for her and her sister, but everybody was talking about how they love the style and love the fabric and everything so much that he's basically started like a little mini production company within the unit. So they were $10. So I purchased one. It's reversible. So one side has like this pretty floral print and the other side has like a American vibe. It's stars. So this is the one I decided to get. And then I have an umbrella as well because I don't want to get caught in a torrential downpour. Then I also have my GVS mask as well. So I carry this with me just in case I need to wear. So yes, I purchased this because I did not know what the PPE situation was going to be like. I wanted to make sure I was prepared. It's better to be over-prepared than under-prepared. Have I had to wear this yet? No. Could I wear this? Yes. I've seen people wearing it. However, I am still wearing N95s. There are enough N95s, thankfully, by the grace of God, and the surplus that we have been able to receive at our hospital, that we are able to change them out if they're visibly soiled, if we drop them. We don't have to always wear them 4 or 5 days straight. We can change them and also keep the surgical mask over them. So I have not felt like I needed to pull out my GVS, but I do have it. And I do keep it with me because if I feel like I ever need to, or for whatever reason management starts flipping out about these N95s, I will put this on. So I keep in here also some drug reference cards. So this is commonly used IV cardiac medications just in case I needed to flip through something. I always like to be prepared. I always like to remain educated, and I don't want to be caught in a situation where I'm like, wait a minute, what is this? What is this? What is this? So I keep that in here, as well as a quick drug reference card, which is much smaller, that I could keep in my pocket if I needed to. So like super quick, Levophed, concentration 4 milligrams and 250, or 16 mics per mil. I know dosage on here 2 to 20 mics per minute. However, I have patients up to 30 mics. So just, you know, super quick reference if I needed to. Or a drug, you know, that I may have not been familiar with or haven't seen in a long time, and I have a patient on a nicardipine drip or whatever. I'm going to be like, okay, so what's my dose here? 5 to 15 milligrams an hour. So something like that. And this is something that I've actually had with me for a while. A lot of this stuff kind of just goes with me from facility to facility. So on my badge, I carry with me another quicker reference because it's also on just like the little pull string. So it's blue. I need to relaminate it because the paper is falling off. But it also has on here Nimbex, Mannitol, Precedex, Amio, Cardine. I can continue. But yeah, so I keep these literally everywhere because we're all human. We all can have a brain lapse and think, wait a minute, Levo, what's my max dose? Or Epi, wait a minute, what's my max dose? Like, how quickly can I titrate up? How quickly can I titrate down? I always keep little quick reference cards everywhere and just make sure that they're up to date. Shears, I keep these with me. There's packaging that is so hard to open, you guys. The packaging for not just like the fluid bags that are in that plastic that's easy to rip, but the potassium, there we go. The potassium packages. I have the hard, you're like Incredible Hulk if you can just pop that plastic. That is some hard plastic. I always have to find scissors or something to cut that. So I try to make sure that I always have my scissors with me. So these are just pink scissors and I have my name on them right here in the white, as you guys can see, because stuff like this will grow legs and walk on you, I'm telling you. So moving on to my actual bag, what I also really like is there's a little flap inside here. So I keep things in there as well. So when you unzip, I do have feminine products. So you guys know I'm a woman. Things happen. things happen to coworkers. I've had coworkers, you know, come up to me, ask me in private, hey, do I have a tampon? Do I have a pad? I'm like, yeah, I got you, sis. So yeah, I mean, I have pads, I have tampons, things happen. So I keep those with me. I also keep a little card holder. And in this card holder is identification. And when I say identification, identification for me as a provider. So yes, I have a copy of my ACLS. Yes, I have a copy of my BLS. Yes, I have a copy of my PALS. Yes, I have a copy of my trauma nursing core certification. Yes, I have a copy of my nursing license. Blah, 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 whatever. Even if I have to print something out online and cut it into a small wallet size, I'm going to keep it with me. Just because you never know, especially now being a travel nurse and being new to facilities, some stuff doesn't always translate over well through email or fax or scan. You'll find yourself now having to give multiples of the same thing to multiple people. And it's just easier now for me to be like, okay, look, here you go. Take a picture, click, go ahead and take this, scan it in, do whatever you need to do. So it's a lot easier now. So I keep this with me. All right, moving on, because there's a couple other goodies in here. I do have a little pack of gum, which mine's almost out. This is the extra spearmint. So just sometimes I just want something with some flavor for me to chew, whether it's with the mask on or not. Like I said, a lot of this stuff I carry with me from facility to facility. This is my, well, it's crushed up now, but this is my box of face protection that I carry with me that you guys see me putting on my face before I go in. So this is, I put everything in one box. So this is the Tegaderm for my cheeks and the little heel cushion for the bridge of my nose. So all of this stays with me. And then moving on, because like I said, this bag has so many compartments, we're going to go into this outside zipper here. So like I said, you guys, I'm like a walking pharmacy. And here we go. So I keep Tiger Balm patches because lifting, shoving, rolling, moving, everything. A lot of times I will have lower back pain, I'll have knee pain, or if it's that time of the month and I'm having cramps, they're radiating to my lower back, I will run into the bathroom, I'll put a Tiger Balm patch on. I have Midol, because like I said, you're going to need it. And then I have more medication in here. So this is like an old prescription bottle. I pulled part of the label off that had like my name on it. And I'm the type of person, I know what the pills look like. So I take a bunch of different pills and put them all in one bottle. So I have, I hope this video does not get flagged because it's really not like that, okay? I'm just trying to tell you guys the medication that I take with me, just in case I, you know, get sick or don't feel good at work, so I can still keep working. And then I also don't like to carry a bunch of various little bottles, so I'll put everything in one bottle. Like, I know I'm not the only one. So yeah, there's Aleve, there's Excedrin, there's Nexium, there's the Pepto to Go tablets. Like, you guys, literally everything that I think that I could need is going to be in here. And it's the same when I travel. I literally do the same thing. If I have an upset stomach, I'm going to take a Pepto. If I have minor aches, I'm going to take Aleve. But if I have a headache, I'm going to take Excedrin, because I'm the type of person, it's just my body. And because I am a migraine sufferer, I do have migraines, Aleve won't help my migraines. So listen to me, they'll help a headache, but they won't help a migraine. If I have a migraine, I have to take Excedrin for migraine. So I have to stop it before it gets to that point if I can. So that's why I have things in here for various different aches and pains and stuff. Like, I'm not carrying around a Aleve bottle, Excedrin bottle, Pepto bottle, Nexium bottle, Tiger Balm patches. Like, I know I'm not. And then my stethoscope, of course, stays in the car, in case you guys are wondering, well, where's your stethoscope? You're a nurse. Honey, don't worry about my stethoscope. My stethoscope is in the car. We work with patients that are not only COVID positive, but a lot of them already have secondary bacterias, secondary skin infections and things like that. So every patient has their own disposable stethoscope anyways. So my personal Littmann stethoscope never goes in the hospital, never goes in a patient's room, and does not go anywhere past my vehicle. Every patient has their own patient assigned stethoscope. So yes, that's why it was not featured in today's video. But I hope you guys have enjoyed this video. I hope that a lot of the items here you guys will consider carrying with you if you don't already, just to make your work life a little bit easier. And yeah, so yeah, let me know your thoughts in the comment section. I will link this bag also as well if I can find it. And as always, I will see you guys in my next video. Bye guys.